Hello, my name is Ian McCall, and I want to give you a short video presentation to the online weekend workshop in Skin Cancer Histopathology that's presented by the Skin Cancer College of Australasia and the Australian Institute of Dermatology. This course has been going now for about 12 months. It's been run twice in that time. It's been run very successfully. What's the course all about? And note that this is an online course. In other words, it's delivered over a Saturday and a Sunday morning as a series of online lectures. The thing about these lectures is that they're highly interactive. They're done in such a way that audience participants can ask questions and can have them answered at the time. The beauty of the presentation is the quality of the slides that you're going to see, and all of this is in high definition. One of the problems if you go to a conventional meeting is both the cost and time away from family in attending that meeting, but also the ability to see what's being presented. If you're 70 or 80 feet away from a screen, it can be very difficult to see the finer aspects of histopathology. But in this type of online presentation, with a high-quality monitor and good slides, you can see everything in immense detail. The course is presented by these three authors. My name is Ian McCall. I'm the Fellow of the Australasian College of Dermatologists, and I'm also the Education Officer for the Australian Dermpath Society. Cliff Rosendahl, who has done most of the preparation of material for this course, is in full-time practice as a general practitioner in skin cancer practice. And Cliff produces these slides through his excellent Olympus microscope with a Canon camera connected to his computer. Cliff has now a collection of about 5,500 consecutive cases of lesions that have been biopsied and excised, and he has not only the clinical images of these cases, he has dermatoscopic images, and he has histopath images. So this is an immense resource that we've been able to call on. I have had an interest in dermatopathology for some years and have a similar setup to Cliff with a series of images that we've used as well. And the third presenter will be Dr. Ian Katz, who's a specialist dermatopathologist in Sydney. What are we trying to teach you? Well, the main thing that we're going to be trying to do is to give you an understanding of a dermatopath terminology and process. If you're in skin cancer practice, then you know how important your biopsies and your histopath reports are. But it's equally important that you can correlate your dermatoscopic images with the report that comes back. And it's also important that you can correlate what you're seeing clinically with the report that comes back. It all has to make sense. The best thing you can do is, in fact, organize a session with your local histopathologist and take the clinical photographs and the dermatoscopic photographs of the cases that you're interested in, and then go down, present these to your pathologist, and have the histopathology presented to you. To enable you to do that, we'd like you to attend this course, because what we'll do is give you an understanding of the terminology, the path processes that are involved in preparing slides, and what's involved from the histopathologist's point of view in giving you a report. If you have that sort of understanding, then when you sit with your histopathologist, you'll be able to ask sensible questions, and you'll be able to see where your pathologist is coming from. You'll also know what the strengths and the weaknesses of histopathology are. And it's an interesting topic that once you've done this course, you'll be able to understand much better. It also allows you to communicate very effectively with your pathologist. And if your pathologist knows that you're really interested in histopathology, they'll take a lot more care and attention with your specimens, in the sense that they'll appreciate that you want to learn and that you understand about the processes that are involved here. And I think you'll you'll find you'll build a much better relationship with your dermatopathologist if you're both speaking the same language. And this little bit here, in empowering the practitioner to recognize histological features of these common skin neoplasms, because we're going to be dealing with most of the common things, the BCCs, the SCCs, the melanomas, but some of the benign lesions as well. It's very important you understand the histopathology of those, and to understand Spitz nevi and spitzoid melanomas and other areas, other terminology that your pathologist is going to use. And even the concept of dysplastic nevi, it's important that you know what your pathologist means when he uses that word, if he uses that word. We'll cover all of these things in this series of lectures. And this is just a list of the things we'll do. Clinical histological correlation, looking at things clinically and the information that you can glean just from that as to what the histopathology is going to look at. We'll look at histological diagnosis of most of the non-melanocytic skin tumors, the melanocytic ones. And these last two lectures on Sunday are particularly good. Dermatoscopic histologic correlation. Most of you, if you're in skin cancer practice, will be using a dermatoscope. And it's important that you're able to correlate what you're seeing with your dermatoscope with the histopath report that you get back. Also, the last one is a particularly good lecture that's delivered by Cliff on dermatopathological dilemmas. And this is done with case presentations, with direct delegate interaction. The great value of the online method we use is that you can ask questions at any stage, and we're able to see when you want to ask a question and bring you in and have that question asked at the time. How do we give you the material? Well, first of all, there's a pre-course material that we give you. Let me just show you what that pre-course material will look like. You get access to a specific website, and this website will have a 350 odd slides. I'll just briefly sort of scroll down here. 350 odd slides, which will tell you about histological terminology, will select areas from each of the lectures that we're going to speak about, and show you some of the images that are in there, and introduce you to the ideas that are going to be covered in those particular lectures. So rather than go right down to the bottom here, it just gives you an idea. You can see the quality of the material that you're going to get. Each of these, the pre-course area, in fact, is divided up into a subsection, and there are 4 40-minute videos which are within the pre-course material. This is the first of them there. These videos are in fact done by me, and we go over the pre-course material and explain it, so that not only are you able to look at the slides and what have you, but you can go through the video, and it will help you when you're doing the pre-course work. In the pre-course resource, you also will get introduced to virtual microscope websites. These are websites where you're able to go and click on a particular slide and work your way through it using technology that's very similar to Google Earth, where you can move around the slide, go into individual parts of it, and get a feel for what it's like to look through a microscope if you don't happen to have one yourself. There's a virtual bookshop that will introduce you also to some of the texts that you may find useful. This is the one that we primarily recommend now, Cancer of the Skin by Rigel. And it's an exceptionally good book that if you're involved in skin cancer work, you should have anyway. But Clay Cockrell did the histopathology in this, and you'll find the images are very good, and the fact that they're there in relation to the clinical material is what makes this book very useful as a histopath book. This is a book on dermatoscopy that I think you also should get. It's in fact written by Harold Klippler with Cliff Rosendahl, Alan Cameron, and Philip Shandel as the additional authors. Now, as I say, Cliff is one of the presenters of this course, and he's contributed several chapters to this book along with Alan Cameron. And I think you'll find this is one of the best dermatoscopy books that you can possibly get. These are some other books that if you're interested in dermatopathology, you can click on these. It'll take you to the Amazon website and you can in fact look through them. Whedon's Skin Pathology is probably the finest textbook of dermatopathology that's out there, but it's a very advanced book and you certainly don't want to purchase that, I would think, at this stage. And Derm 101 website is an excellent website that we'll introduce you to later for looking up and looking at examples of histopathology cases and dermatoscopy cases. We also provide you with some journal articles and what happens after the course itself. Well, as I say, the course itself is going to be run on a Saturday and Sunday. The course is done online. You'll be invited to webinars and you simply log into the webinars. There are practice webinars beforehand. There'll be about 3 practice webinars so that you're quite au fait with the technology that we're going to use. It's only point and click. You don't have to be an expert in computers to be able to join one of these meetings and to play a part in them. And the technology is very stable. We've had no problems whatsoever in the 2 occasions in which these weekend meetings have been run. And we've had people from Vancouver, from Wyoming in the United States, from Ireland. In other words, you can join this join this course, the weekend meeting, from many areas of the world. It's run even from the States. When it was run here in Australia from 9 o'clock through till about 4:35 in the afternoon, it meant it was run in Vancouver, I think, from about 4 in the afternoon through till almost midnight. But the people who participated were very enthusiastic and felt that it was an excellent experience and well worth their while. When the course is done, when the weekend's done, all the webinars are recorded, and what happens then is that the website is updated, and it then looks like this. As well as having the additional material and the pre-course study material, you'll have the full set of images in all the lectures. So you'll have all the lectures in PowerPoint form here that you'll be able to access. But what's even better is that you'll have the videos of the complete course. And these were the ones for the latest course that we just finished last weekend. You're able to access these videos. They're private videos, and it's only if your email address is one of those allowed to view it that you're able, in fact, to view them. But the advantage here is that you can look at these videos afterwards. You can go back to them. You can use the cursor to work your way along to any particular section in the video that you, in fact, want to view again. And you can go over exactly what was said at that time. Now, this is the big advantage of this type of presentation in comparison to going to a meeting. You perhaps take notes when you're at a meeting, but 1 to 2 weeks later, you've forgotten most of the major things that are there, or you would probably like to go back and listen again and go over what the presenter said, but you're unable to do so. The great virtue of this type of meeting is that you'll be able to have access, continuing access to this particular website for up to 12 months afterwards. So I think you'll agree that the concept is good. The cost is much less than attending a conventional meeting. The presenters have been doing this for some time now and have refined the presentation technique. And the technology works. I'd thoroughly recommend this course to you. We found some years ago that histopathology was the main area of weakness in skin cancer practice, and we set out to try and remedy that. And we're quite happy that we've in fact done that. The reviews that we've had, because we send out a survey afterwards when each course is completed, the reviews that we've had from those people who have participated have been excellent. And what we may well do is I'll put a link in here to the anonymous reviews and give you a chance to actually see those for yourself. So we'll put that in, I think, to the promotional website that I spoke about before this one, the Dermatopathology Online Workshop Preview. I'll put a link in here. You'll be able to register for the next course by clicking on this link here, and I'll put in a link to the anonymous survey. It'll give you an idea of what people thought, where the strengths were, where they felt any weaknesses were. And this you don't normally see. You normally see just selected quotes from individuals. Well, we're happy enough to give you access to the full survey review. And you only do that if you're very confident of what you're presenting. So I hope this has given you an overview of what we intend to do, how we intend to present it, and the quality of the material. What you should do now, if you've got time, is work your way down through all the slides that are here. This is just a small sample of the slides. As I say, there's 300 odd that you'll get in the pre-course material. And you'll then get all the presentations afterwards to be able to review at your leisure. I hope you've enjoyed this introduction. If you have any other questions, you can contact me at my email address, which I'll put at the top of this presentation as well, and we'd be happy to answer them for you. This course is has various CPD points from both the College of General Practitioners, from the Skin Cancer College of Australasia, and from the Rural and Remote Medicine College of Australia as well. Thank you very much.